So if a patient goes to you, they're of the two categories. They're currently wearing a denture, or they have teeth that are so bad they all have to be removed.
Correct.
What are their dental implant options in your practice?
Yep, cool, great question. Several options for our denture wearers. We have a denture, right? Which, gosh, it's one of the worst things we do in dentistry.
Okay.
It covers, for the top one, it covers the roof of the mouth. You can't really taste anything very well. It gives you about, I'd say, 10% of function, is as if you had all 28 teeth. And we say 28 because wisdom teeth don't count. Okay, so all 28 teeth. The second one is snap-in teeth. Now, snap-in teeth...
You're not a fan of those?
I don't personally like snap-in teeth. You still...
Because the patients don't like them?
You don't get the level of function still. It is made out of old school acrylic still, like the denture material.
So it's still a denture?
It's still a denture.
Okay.
It's just a removable option now that has a snap-in capability. You're still not going to be biting into apples or corn on the cob, right? The pressure that you place on those front teeth can unclick it or unsnap it, and then your teeth fall out.
Is there maintenance out of pocket? I mean, does it come loose?
It does come loose. There is actually held in by like an insert, this little plastic piece.
Okay.
And just, the more meals you eat, the more you have to change out that insert.
All right.
Yep, correct.
Okay.
One cool thing that I can do though, and I'd say about when we break it up between the people that want snap-in teeth versus permanent teeth that don't come out, that ratio is usually 90% of people want permanent teeth. About 10% of people still want snap-in for some reason.
Okay.
I'm okay with doing it. But one of the cool parts that I do in my clinic are I give the same day snap-in teeth on the bottom,
Okay.
which is really cool.
Okay.
So I say 10% of people will still come in and say, hey doc, I want permanent teeth on the top, but I want snap-in teeth on the bottom. Say, hey, cool, if that's what you really want.
That's a little less expensive.
It's a little bit less expensive, so it helps
Is
people
your
financially.
secret goal to kind of graduate them to teeth that don't come out on the lower?
Great, fantastic question, because this is the part that I run in while teaching all the time, is when you're doing one surgery and the patient says that they may want to upgrade to permanent tooth later down the road, you have to do this surgery in a specific way. You have to place the implants at the correct depth. And if you don't, you have to take out all the implants later and it costs more money. Okay. So in my practice, I actually place the implants as if I was going to be doing permanent teeth. Then it's a very easy transition to actually get that person to upgrade later down the road. And I do quote them for an upgrade fee, basically.
Okay.
So I kind of walk them through, if you want to do snap-in now, perfectly okay with that. This is what the option will be to upgrade it later. It isn't really any more expensive to do so.
And you could do this in 3 visits. Visit 1 is get to know, you meet them. And then the second visit, you take measurements and all the information you need. And then the third visit, they get their new teeth.
Yeah, correct.
That's no exaggeration.
Nope, no exaggeration.
Okay.
Yeah. And our last option when we do permanent teeth, the permanent teeth that do not come out, this is our best, this is our most favorite one, right? Because when you have permanent teeth that don't come out, now, when I was talking about that kind of scale of the percentages, now you're at 90% of what you had when you had all 28 teeth. The only difference, that 10%,
what do you mean 90%?
That means that you can chew and eat everything that you were to be able to before. Steak, right? Steak, corn on the cob, beef jerky, sticky foods, chew gum, right? Even gum is one, right?
Okay.
Chew celery, bite into celery, right? All those good vegetables, crunchy vegetables, granola, all of those that you can eat now, again, which is fantastic.
And you could be like 90 years old and do this.
Yes, yep. My oldest has actually been 89 years old so far, but quite a few of my friends have treated someone that's even, 96 years of age.
So if somebody says, well, I'm 75 and I'm just too old, it's just not the case.
It's not the case.
Okay.
It's not, because what they don't think about is they might be having that reaction because maybe their mom or uncle had a denture and they're used to them being shy or staying away from communicating or eating or smiling. But what they don't know is they just haven't gotten there, right? But you don't want to wait that long, because if you wait that long, what you're doing is you're just losing bone.
Okay. Yeah, but isn't it true, if you've been wearing a denture for like 10 years, you can't do this, you don't have enough bone? Not
true. Not at my office. I have specialty training to actually place a different type of implant. That way, people that have been told in the past, oh, sorry, implants are not an option for you. We get this all the time, right?
Okay.
And there are definitely still options out there.
Now, you teach... you have a training institute in Colorado. You teach dentists from all over the country on how to do this.
Yes.
Does it cost more to go to a guy like you?
It actually costs less, because I do everything in-house myself.
Okay.
Right? I don't need to send the patient on a tour of the city to go around to all these different people to get the surgery done, the teeth done, all that, right? Everything is done in-house under myself. I also have the technology available to do this in-house. We actually print teeth nowadays, and printing teeth can take about 30 minutes. I can print you a new set of teeth. That's way less expensive for me to do that, and it looks way better and way stronger than the guy down the road who's still, doing it off a denture.
So no more dentures.
No more dentures. Yeah.